నమస్తే, వెల్కమ్ టు హెలో డాక్టర్. బేరియాట్రిక్ సర్జరీ అంటే ఏమిటి? మధుమేహాన్ని నిర్ధారించే పరీక్షలు ఏంటి? మధుమేహంతో పాటు ఊబకాయం ఇతర వ్యాధులను కూడా కలిగిస్తుందా? ఊబకాయం, ఆ బ్యారియాట్రిక్ సర్జరీ, మధుమేహం మరియు బరువు తగ్గడంలో వచ్చిన ఆధునిక చికిత్సా విధానాలపై మరిన్ని వివరాలు మనతో మాట్లాడేందుకున్నారు డాక్టర్ అభిషేక్ కటక్వార్, బ్యారియాట్రిక్ అండ్ మెటబాలిక్ సర్జన్ మనతో ఉన్నారు. ఆయనతో మాట్లాడదాము, దీని గురించి మరిన్ని విశేషాలు తెలుసుకుందాము. అయితే మీరు ఆయనతో మాట్లాడాలనుకుంటే స్క్రీన్ మీద కనపడుతున్న నెంబర్స్కి కాల్ చేసి మాట్లాడేసేయచ్చు. నమస్తే అండి.
నమస్తే.
సో వాట్ యూ సే అబౌట్ బ్యారియాట్రిక్ సర్జరీ? అంటే వాట్ ఐఎమ్ ట్రైంగ్ టు కన్వే, metabolic surgery. You said like a bariatric surgery come metabolic. What is that?
So bariatric is a word which comes from Greek language, baria, which means obesity, and bariatric surgery is a surgery for obesity. But the problem is, a lot of people think that this is a cosmetic surgery. This is not a cosmetic surgery. People confuse it with liposuction. So the first thing is, this is not liposuction. The other confusion people have is this surgery is done by open surgery. So this surgery is done completely by laparoscopy. We make small 2-3 holes and we perform the surgeries looking into the camera, and there is no big cut. So these are the two advantages of bariatric surgery.
Okay. It is common to have both diabetic and obesity at the same time?
Yeah, see, obesity is mother of all disease. Once somebody becomes obese, it invites other problems like high cholesterol, snoring, which is called sleep apnea, then people get fatty liver, then diabetes, metabolic problems, infertility. There are so many things. So with obesity, diabetes can happen, and in fact now we are the world leader in diabetes. When we look at the data,
yes, of course,
India is the biggest number of diabetic people in the world.
Okay, how do you treat diabetic people?
So you asked me a question, bariatric and metabolic. So I answered about bariatric. Now metabolic surgery is an advanced version of bariatric surgery, wherein we do surgery not only for obesity but for diabetes. So to treat metabolic problems. So diabetes is one of the metabolic problems. So advanced version of bariatric surgery is called metabolic surgery. In fact, when metabolic surgery came into the picture, a lot of people did not believe that there could be some treatment for diabetes. So it will be wrong if I say diabetes can be cured. Diabetes cannot be cured, but it can be controlled with medication or by some procedure, and metabolic surgery is one of them.
Okay, so it cannot be cured, just it will be in control state.
Yes.
By this surgery?
Yes.
Okay.
So if anybody is claiming that some modality can cure the diabetes, it's a kind of
yes,
myth.
Yes, I got confusion on this. Finally you clarified this. Okay. Anyhow, थोड़े लोग समझते हैं क्या है ये मामला, क्या है ये डायबिटिक, क्या है ये मेटाबॉलिक सर्जरी, क्या है कैसा करते हैं, ऐसा सब लोग उसके बारे में सोचते रहते हैं. व्हाट डू यू से?
सो कन्फ्यूजन ये है, लोगों को समझ में नहीं आता कि क्या होता है सर्जरी में. सो मैं आपको सिंपल समझाता हूँ कि कैसे मोटापे से डायबिटीज़ आता है. सो सबसे पहला चीज़ है, उसके लिए हमको समझना पड़ेगा इंसुलिन. इंसुलिन एक हार्मोन है जो पैनक्रियास की ग्रंथि सिक्रीट करती है. पैनक्रियास का ग्लैंड स्टमक के पीछे होता है, और इंसुलिन का काम है, जब भी आप कुछ मीठा खाते हैं, आपका ब्लड शुगर लेवल बढ़ता है, तो पैनक्रियास इंसुलिन रिलीज़ करता है. ये इंसुलिन एक की तरह है, एक चाबी की तरह है, जिसका काम है मसल्स के दरवाजे खोलना और उस शुगर को मसल्स में धकेलना, ताकि वो मसल्स उस शुगर को फ्यूल के जैसे यूज़ करे. सो बेसिकली हमारे जो बॉडी की मसल्स है वो मशीन है, और शुगर एक फ्यूल है. अब आप इमेजिन करिए कि अगर कोई इंसान जब मोटा होता है तो उसकी बॉडी में इंसुलिन रेजिस्टेंस आने लगता है. इंसुलिन रेजिस्टेंस का मतलब इंसुलिन आता है बट वो दरवाज़ा नहीं खोल पाता, क्योंकि फैट उसको दरवाज़ा खोलने नहीं देता.
ओके.
तो क्या होगा, बॉडी में इंसुलिन लेवल बढ़ने लगेगा.
इंसुलिन की ज़रूरत पड़ती बाद में उनको.
हाँ, तो इंसुलिन लेवल जब बढ़ने लगेगा तो प्रॉब्लम ये होगी कि इंसुलिन वो शुगर को अंदर तो धकेल नहीं पा रहा मसल में,
हाँ,
पर कुछ ना कुछ तो काम करना है, तो वो शुगर को कन्वर्ट करेगा फैट में. सो ये फैट जो है फिक्स डिपॉजिट है. सो इंसुलिन लेवल बढ़ेगा, शुगर यूटिलाइज नहीं होगी, फैट में कन्वर्ट होगी. और इसलिए बहुत सारे लोग ये कंफ्यूज करते हैं कि जब हम बोलते हैं आपके इंसुलिन लेवल हाई है, तो कंफ्यूज हो जाते हैं कि डॉक्टर डायबिटीज तो इंसुलिन नहीं होने से होता है, आप बोल रहे हैं इंसुलिन लेवल हाई है, फिर कैसे डायबिटीज हो गया. बिकॉज इंसुलिन तो है बट वो काम नहीं कर पा रहा, इसलिए आप डायबिटिक हो गए.
ఓకే సో ఇన్సులిన్ ఉంటుంది, ఎక్కువ మోతాదులో ఉంటుంది, కాకపోతే వాళ్ళు డయాబెటిక్ కింద పరిగణలోకి తీసుకుంటారు. అంటే మీరు ఆ కొవ్వును తీసేస్తారు, ఎక్కడైతే కొవ్వు ఉందో जो है उसके वो निकाल देता है पूरा उसका. राइट, ओके, थैंक यू. हाउ डज बैरियाट्रिक सर्जरी हेल्प? व्हाट यू से?
Okay, so now as I said, our human body is controlled by hormones and insulin is one of them, and the whole system works on a balance between good hormone and bad hormone. So bad hormones are the hormones which keeps you hungry, which causes fatty liver, which causes stress eating, which causes other problems. Now we want to balance between good and bad. So what we do in bariatric surgery with laparoscopy, we go inside and there are different types of procedure like sleeve gastrectomy or a Roux-en-Y gastric bypass or one anastomosis gastric bypass, and all these procedures are different, but the mechanism is same. We want to reduce the bad hormones by this surgery and increase the good hormones. And you will not believe the first and the foremost effect which happens after this surgery within 24 hours is the sugar level coming to normal without medication. Weight loss will happen slowly over 6-8 months,
Okay.
but the sugar level will come normal within 24 hours.
जो एक क्वेश्चन रेज हो रहा था, एक बार बैरियाट्रिक सर्जरी, मेटाबॉलिक सर्जरी कंप्लीट होने के बाद उनको शुगर लेवल्स जो रहते हैं ना वो कंट्रोल में आ जाते, आप बोले जैसा, फिर भी अगर वो वेट गेन पड़ेगा क्या अपकमिंग डेज?
बहुत ही इम्पॉर्टेंट क्वेश्चन आपने पूछा है. बहुत सारे लोग ये सोचते हैं कि जैसे मैंने बोला, पहली चीज़ हमको ये नहीं मानना है कि डायबिटीज़ क्योर हो जाता है. डायबिटीज़ कैन बी कंट्रोल, कैन अंडरगो रिमिशन. Bariatric surgery is not a magic surgery. So one has to understand this is like resetting your system. You are using your laptop, there is a virus in your laptop. What do you do? The last thing you can do is reset your laptop. So this surgery will reset your system. You will lose weight, your diabetes will come under control, but if you are not conscious enough, if you know what is right and what is wrong, you will maintain that weight. But if you start taking things for granted, like, oh, I lost weight, I'm good, and somebody will come and say, why don't you eat one pastry? You have lost weight, you look good. So that should not happen. Good and bad habits should be clarified.
Okay, so हम लोग जो ट्रीटमेंट ले रहे थे और जो मेंटेन कर रहे थे फूड डाइट, उसके वजह से पूरा कंट्रोल में रहता. ओबेस हो, अगर डायबिटिक हो, राइट, वही बोल रहे साहब. अच्छा, ठीक है. मेरे को एक क्वेश्चन था. आजकल बहुत लोग इनफर्टिलिटी प्रॉब्लम्स में थे, बहुत लोग थे, तो वो इनफर्टिलिटी ओबेस के वजह से हो रहा बोल के बहुत आर्टिकल्स भी आए थे उसके बारे में. सी, ओबेसिटी को कंट्रोल करने से, ये बैरियाट्रिक मेटाबॉलिक सर्जरी को आप फॉलो करने से फर्टिलिटी का प्रॉब्लम सॉल्व होगा?
देखिए, डायरेक्टली तो हम किसी को प्रॉमिस नहीं कर सकते कि बैरियाट्रिक सर्जरी करने से इनफर्टिलिटी ठीक हो जाएगी. बट देयर आर लॉट ऑफ इनडायरेक्ट एविडेंस, इनडायरेक्ट प्रूफ. इनफैक्ट लॉट ऑफ माई पेशेंट who came to me with obesity and they had infertility issues, they underwent bariatric surgery and they conceived normally. The reason is, सबसे बड़ा प्रॉब्लम आज की डेट पे 90% ऑफ वुमेन हैव पॉलीसिस्टिक ओवरी. पॉलीसिस्टिक ओवरी का मतलब ये है कि नॉर्मल जो ओवरी का जो साइकिल है, ओव्यूलेशन एंड अदर थिंग्स, वो नॉर्मल नहीं हो पा रहा है. उसके कई कारण हैं. लाइफस्टाइल देख लीजिए, हमारा हैबिट, डाइट हैबिट बहुत ख़राब हो गया है. वी आर ईटिंग लॉट ऑफ जंक फूड, और इन सब की वजह से ये हार्मोनल इम्बैलेंस होता है. अल्टीमेटली, एज आई सेड, बैरियाट्रिक सर्जरी विल रीसेट योर हार्मोनल सिस्टम.
ओके,
सो जब हार्मोन्स रीसेट होंगे तो ऑब्वियसली गुड हार्मोन्स में फीमेल के गुड हार्मोन्स भी हैं.
आप बोले जैसे चर्बी निकल जाएगा तो पूरा सेटराइट हो गएगा बॉडी में का, वही वो बोल रहे थे आप. अच्छा, ठीक है. ओबेस के वजह से जॉइंट पेन्स वगैरह पूरे आते रहते. बहुत लोगों को इश्यूज फेस कर रहे थे, कमर दर्द बोल के, स्पाइन दर्द बोल के, ऐसा ओबेस के वजह से. सो बैरियाट्रिक सर्जरी कंप्लीट होने के बाद, लाइक मेटाबॉलिक सर्जरी कंप्लीट होने, वो सब पेन्स दूर हो गए?
सो आई विल गिव यू सिंपल एग्जांपल. इमेजिन a builder is trying to make a 10-story building and he finished 10-story building, but he wanted to build more, so he start building on the right side, left side, this side and that side. So what he is doing, he is putting extra weight on the central columns and the beams of that building. Obviously that building will start tilting. The same thing applies to the knee. if so, first thing I should tell you what should be the ideal weight of a person. So ideal weight of a person is height in centimeter minus 100. Like if my height is 175 centimeter, 175 minus 100, which comes out 75. So 75 is my ideal body weight. If my weight increases, so it is a simple example. If you put Maruti 800 tires in a truck, it cannot bear the weight of that truck. So same thing applies. When you are overweight, you're putting extra weight on your spine, on your knee, on your ankle, on your bones, and obviously you have knee pains and other problem. In fact, lot of time people with spine problem who have disc prolapse, they were referred to me by spine surgeon for weight loss.
Okay.
And then they were told that if your pain does not get relief after bariatric surgery, after weight loss, then you may go undergo surgery for spine. So most of them do not need spine surgery. Once they lose weight, their their spine pain goes off, their knee pain goes off. So basically this friction goes off.
ఎస్ సో వింటున్నారా అంటే బ్యారియాట్రిక్ మెటబాలిక్ సర్జరీ చేయించుకోవటం వల్ల చాలామందికి జాయింట్ పెయిన్స్ కావచ్చు, స్పైన్ ప్రాబ్లమ్స్ ఏమన్నా ఉంటే అటువంటివి కూడా క్యూర్ అవుతాయి. ఎందుకంటే కొవ్వు బయటికి వెళ్ళిపోతుంది కాబట్టి, బరువు తగ్గుతారు కాబట్టి అది ఈజీ అవుతుంది అనేది చెప్తున్నారు. కాలర్స్ వెయిట్ కర్ అయితే విల్ గో విత్. చాలామంది కాలర్స్ వెయిట్ చేస్తున్నారు. నమస్తే అండి.
నమస్తే. ఐ వాంటెడ్ టు టాక్ టు డాక్టర్.
ఓకే
డాక్టర్, ఐ యామ్ 68 years old person. I am not having any this one. My BMI is 24. Now recently when I have tested the blood test, HbA1c is coming around 7, doctor, whereas post and pre are coming normal within 100 and within 140. Is it required to start the medication or not, doctor? Now you can advise me.
Yeah, so your HbA1c is high, sir, which means that you have become diabetic. Though your BMI is 24, which means that you are not overweight also, so you have a normal weight, but since you have become diabetic at the age of 68, but you should start medication, because once you start medication your glucose level will come normal. And don't think that if I start medicine for sugar, I'll have to take it for lifelong. Maybe if your sugar comes down normal, you can keep checking your HbA1c level regularly, and then probably if it comes normal, your doses might also go down. But please start the medication for diabetes. Do not wait and do not think that some miracle will happen. And another thing is, if you want to try some alternative method, you can try, but please also start medication which decreases your diabetes.
Yes, our caller Nagaraju Manchiriala. Namaste andi Nagaraju garu. कॉल कट. जब से पूछे थे ना क्वेश्चन, उसके बारे में पूछ रहा था. देखो थोड़े लोग ओबेस रहते हैं, उनको डायबिटिक रहता. ओके, थोड़े लोग ओबेस नहीं रहते, उनको डायबिटिक रहता. सो व्हाट डू यू सजेस्ट इन बिटवीन?
Yeah, so we have specific guidelines for bariatric and metabolic surgery. Metabolic surgery means surgery for diabetes. Now anybody who has a BMI of more than 27.5, the caller had a BMI of 24, so he is not a person who can undergo bariatric or metabolic surgery. Anybody who has a BMI of more than 27.5 and uncontrolled diabetes can undergo metabolic surgery. And anybody who has a BMI of more than 32.5 and other comorbidities, may not be diabetes but have sleep apnea or cholesterol problem or blood pressure or fatty liver or infertility, then they are the candidate for bariatric surgery. A very important question. One should not force bariatric or metabolic surgery in unindicated patients.
So आप बोल रहे हैं कि ओबेस जो है उनको ही आप ट्रीट करते,
Yes.
బాకీ लोगों को नहीं ట్రీట్ करता. హలో డాక్టర్, బ్యారియాట్రిక్ మెటబాలిక్ సర్జరీ గురించి మనం తెలుసుకోవాలనుకుంటే స్క్రీన్ మీద కనపడుతున్న నెంబర్స్కి కాల్ చేయండి. మనతో పాటు ఉన్నారు డాక్టర్ అభిషేక్ కటక్వార్ గారు, ట్రైన్డ్ అట్ యుఎస్, జర్మనీ, అలాగే తైవాన్. సో ఒక మంచి సర్జన్ మనతో పాటు ఉన్నారు. సో ఇది మీరు కనుక కాల్ చేస్తే ఆయన మంచి సజెషన్స్ కూడా ఇస్తారు. ఒబెసిటీ ఈ మధ్య కాలంలో ఎక్కువ అవుతుంది కాబట్టి చాలామంది డయాబెటిక్తో బాధపడుతున్నారు. అటువంటి వాళ్ళకి ఒక మంచి నివారణ ఉంది, దానికి ఒక మార్గం ఉంది, బ్యారియాట్రిక్ మెటబాలిక్ సర్జరీ అంటున్నారు. సో ఆయనతో మాట్లాడదాం. जी बोले थे लाइक बैरियाट्रिक मेटाबॉलिक, व्हाट इज डिफरेंस इन दिस? बैरियाट्रिक बोले तो क्या है, मेटाबॉलिक बोले तो क्या है, व्हाट इज दिस?
So bariatric surgery is basically for obesity, and metabolic surgery is basically for metabolic problem, as I mentioned, like diabetes, fatty liver, infertility, obstructive sleep apnea, cholesterol and other problems.
राइट ओके सर्जन्स बहुत लोग रहते हैं, आप बोल रहे थे ना बैरियाट्रिक सर्जरी के लिए बहुत लोग सर्जन्स है, बहुत लोग के पास बहुत लोग जाते रहते। ओके अगर ये बैरियाट्रिक मेटाबॉलिक सर्जन होना बोले तो उनको क्या क्वालिफिकेशंस रहना, उनके वजह से क्या होता, प्रॉब्लम्स कैसे सॉल्व होते?
So bariatric and metabolic surgery is a very specialized branch, like we have super specialty branch. So I have been doing bariatric surgery for more than 10-15 years, and I don't do anything else. I just do bariatric and metabolic surgery, and over a period of time I have learned so many things related to obesity and metabolic problems. So one has to understand that this surgery is a very demanding surgery when it comes to techniques, infrastructure and other things, and these procedures have to be performed only by people who are specialized in it, and they have a big team who can manage, because they should have a good ICU unit, they should have good cardiologists, good liver team, good critical care team. Everything has to be best for this kind of treatment.
राइट सब लोग को बहुत डाउट्स रहते हैं बैरियाट्रिक ट्रीटमेंट के वजह से, मेटाबॉलिक ट्रीटमेंट के वजह से कुछ ना कुछ साइड इफेक्ट्स रहते हैं क्या बोल के, व्हाट डू यू से अबाउट दिस?
See, I always give this example. Whatever you do in life, you do a risk calculation. What I mean by that, if you want to do something in life, if there is a more risk involved and less benefit is involved, then you never do it. But sometimes if you take a calculated risk for better benefits in future, then you should definitely go for it. The same thing applies to bariatric and metabolic surgery. When somebody comes to me, they have list of problems: obesity, diabetes, sleep apnea, fatty liver, cholesterol, heart issues and other problems, hypertension. So the list is long, and they are taking at least 15 to 20 medication every day. So I tell them that you have multiple problems, you are taking 20 medicine in a day. If we take a calculated risk, probably half of your medication can go down. The problems what you have will solve, but as I say, we have to take that calculated risk after evaluation by cardiologist, liver team, anesthetist, my team, everybody get an evaluation, and then we can plan a surgery.
Yes, so many calls are waiting. We'll go with the callers. Lakshmi Narayana, Hyderabad. Lakshmi Narayana garu namaste andi.
నమస్కారం అండి.
ఎస్ మాట్లాడండి, డాక్టర్ అభిషేక్ గారు ఉన్నారు.
ఏం లేదు, అది షుగర్ ఉంది నాకు యాక్చువల్గా. అయితే యూరినేషన్ ఎవ్రీ 1 అవర్ ఒకసారి యూరిన్ వస్తుందండి. అది దీనివల్ల అనేది
ఎవ్రీ 1 అవర్
1 అవర్ యూరినేషన్ వస్తుంది, యూరిన్ అవుతుంది. అది ఒక ప్రాబ్లం ఉంది. వెయిట్ వచ్చేసి నేను 97 kgs ఉన్నాను.
ओके ये थे कि 97 kgs थे, कहते इनको डायबिटिक था, एवरी 1 आवर को उनको यूरिनेशन आ रहा बोल के बोल रहे थे. व्हाट डू यू से?
सर आपका HbA1c टेस्ट कराया था आपने? योर HbA1c एवरेज 3 month ब्लड शुगर?
राइट, कॉल कट हुआ.
ओके, सो ही इज वरीड अबाउट frequent urination, which is a common problem. Probably his sugars are not under control, and that is why his kidneys are overtaking that job to clear that excess sugar, and that is why he is going for frequent urination. I would advise him to check his HbA1c and fasting and postprandial blood sugar. In fact, if he has diabetes of more than 10 years, he should get him evaluated by a nephrologist, and he should also get evaluated his retina for diabetic retinopathy.
राइट, ये ट्रीटमेंट बैरियाट्रिक मेटाबॉलिक ट्रीटमेंट उनका साइज के बराबर रहता, नहीं तो सेशंस रहते एकदम कंप्लीट करते आप?
So again, this very interesting question. So as I said, bariatric surgery is not liposuction. In liposuction there are multiple sittings are required, whereas in bariatric surgery we do surgery over your stomach, over your intestine with laparoscopy, so that there is no cut. The person can walk within 3 hours after surgery, and then they can go home in 2-3 days, and there is only one sitting required. It's not that we have to do surgery multiple times.
3 hours के बाद वो వాక్ कर सकते हैं. 3 hours తర్వాత వాక్ కూడా చేయొచ్చు అంట. సర్జరీ అయిపోయిన తర్వాత 2-3 రోజుల తర్వాత రెగ్యులర్ వర్క్స్ कर सकते हो.
Yes.
After 3 days discharge के बाद.
In fact, now technology is so advanced that some of my patient after bariatric surgery, they got up from the operating table and they walked.
Oh, very
because
nice.
technology has evolved so much. Not in every center, but in our institute we have a very strong team of anesthesia people, and all our patients walks up on the table and they walk.
और एक डाउट था, इज इट पेनफुल?
So pain is a very subjective phenomena. You know, some people are very pain sensitive, some people don't feel pain. So in fact, I tell all of them that you will have some pain for first 24 hours, but we don't know how much it will be. But when I say this in the pre-operative counseling, because I do lot of counseling, my each session of patient counseling is almost 45 minutes. I spend lot of time with patient before surgery and after surgery, and when I do this perioperative counseling, I tell them lot of things. In fact, it has happened after surgery. One of the patient told me, "Doctor, did you really do surgery because I don't feel pain?"
Okay.
Because they are mentally prepared that some pain will be there, and in fact after 24 hours that pain also goes off once they start walking regularly.
राइट, थैंक यू, अच्छे సజెషన్స్ बोले थे आप. సో బ్యారియాట్రిక్ మెటబాలిక్ సర్జరీ వల్ల డయాబెటిక్ కూడా కంట్రోల్లో ఉంటుంది. అలాగే ఈ మధ్య కాలంలో చాలామంది డయాబెటిక్తో బాధపడుతున్నారు కాబట్టి వాళ్ళలో ఉన్న అంటే వాళ్ళ కొవ్వు మొత్తం కూడా కరిగించేసి డయాబెటిక్ని కూడా కంట్రోల్లో పెట్టాము, ఒబెసిటీ అనేది మెయిన్ కారణం కాబట్టి అంటున్నారు. సో ఖచ్చితంగా ఇది బాగా ఉపయోగపడుతుంది అంటున్నారు. ఏఐజీ గచ్చిబౌలి హాస్పిటల్ నుంచి డాక్టర్ అభిషేక్ గారు మనతో ఉన్నారు. ఇప్పటివరకు మనకు సలహాలు ఇచ్చింది అభిషేక్ గారు.